Now it goes through different streams. And when you look at healthcare and the health systems, we're looking at it from the perspective of the continuum, right? From almost home to hospitals and back to home. But as you know, the stress on the health system is actually increasing because of the population aging, because of non-communicable diseases going up. And every year you have new chronic diseases adding up to the pile that was there previously. And therefore kind of putting more and more pressure on the health systems that cannot cope with the influx of patients. When you were diagnosed with diabetes 40 years ago, it was disaster news. Right now, it's not. You will be treated, but you will be consuming health services for 30, 40 years, which puts a lot of pressure on this system. So we look at it from the perspective of how do we not only enhance the life of people, but how do we help doctors, nurses, caregivers in general, government, health system in general, kind of cope with this. So through our technology, we kind of have, different pronged type of technologies. Imaging, we're reducing the impact of our imaging modalities on the environment. We're reducing the usage of some finite resources like helium. In terms of software, we're building softwares that are from the ground up, willing to take the next leap in technology, which is artificial intelligence, which will reduce the burden on the caregivers because it will do a lot of the automated tasks so that we free doctors and nurses to do what they should be doing, which is taking care of the patients. So from this perspective, we look at it as pervasive technology models that will basically help the health system cope. The second thing for me is how do we ensure that all of us, industry, government, payers, caregivers, collaborate so that we have one single goal, we look at the same direction, which is basically increasing the patient experience and patient satisfaction. Absolutely critical, because as an industry, we need to collaborate with the government because they produce the policy, the guidelines, and how we should be working in a country. And I've been quite impressed with what Abu Dhabi Health Department have done, because they're looking, at the future-proof solutions. And the future-proof solution doesn't mean that we need to replicate what has been done and scale it. We need to think of new things, new technology. How do we ensure that the technology is pervasive to the way the doctors are engaging with their patients? One example, Malafi in Abu Dhabi. Malafi is a health information exchange platform that actually has all the patient data that can be shared with all the caregivers in Abu Dhabi. What does this mean? That it means you have one single version of the truth when it comes to patients. You have all the medical history of the patient, accessible to any doctor licensed in Abu Dhabi. You can have all the images that have been taken. So you reduce the number of images and scans and MRIs and X-rays that are done to the patient. Therefore, you reduce costs, but you reduce the radiations that the patients are receiving. And all of these kind of might appear like, small increments, but when added up, this has a huge impact. Yeah, we've been part for some time with the Partnership for Health Systems Sustainability and Resilience, and it's all in the name. We need to ensure that the health system can cope with crisis, but can cope with what is coming, creeping in slowly. And this is where Philips, as a major contributor to this consortium, comes with some ideas. How do we ensure that climate change is taken into account when building strategies for health systems? How do we ensure that we put, our industry in kind of into the future? Meaning, how do we design our products to be eco-designed? How do we ensure that we reduce the use of plastics? How can we use more recycled material? How do we ensure that we have less helium in our MRIs so that, kind of instead of putting 1,500 kiloliters of helium in an MRI, you only put 1.5 liter. And all of these are our thinking about how healthcare should be. Healthcare is a major contributor in global warming, in climate change. If healthcare was a country, we would be the 5th contributor to global warming. And therefore, we have a mission to do that. So we are in our healthcare dilemma, which is basically we are producing those not so good, carbon emissions, but we're also taking care of the patients that are the victims of that. So we really need to take it seriously in terms of how the contribution of the industry is center to the global policies on climate change. Health has been, for the first time in COP28, included. When the ministers met, it's not just the ministers of environment, but also the ministers of healthcare have been met. And this is a good sign that this is something that is taken very, very serious. Actually, the best AI is the AI that doesn't appear, that is completely transparent. So it's pervasive. So AI is not a product. It's a way of doing things. And if a doctor can spend 95% of his time looking at the patient instead of looking at the computer, this would be a huge gain. Actually, the initiatives I've been seeing that for across the 2 days that I've been here. And the thinking, the vision is absolutely critical. How do you ensure that what you're doing today is future-proof for the next 20 years? And there's no other way to do it with technology, and AI will be a major, major contributor to that. And therefore, the commitment of the Abu Dhabi government to AI, for me, is exactly what needs to be done across the globe. Thank you.